I was in an interview with somebody, and the person was telling me that the parent died from kidney failure. And it's important that we know what can cause this kidney failure. A lot of things can cause kidney failure, but in Nigeria currently, the major causes of chronic kidney failure is hypertension. Then in the world, generally, is diabetes. And so it is important that we know what can cause this to reduce the incidence, and also to reduce the risk of coming down with chronic kidney failure. Now, kidney failure has stages, and before they tell you that you have a end stage renal failure, it simply means that your GFR, what your kidney does, is that your kidney has a way of regulating electrolyte and fluid, and once your kidney has reduced to up to 15%, less than 15%, then that patient is considered to have a end stage renal failure. And in that case, many of them depend on dialysis, which is an artificial kidney. And so it is important to know what causes this. Number one, diabetes. Number two, hypertension. Number three, herbs. Like, a lot of people consume herbs a lot, and they don't know that after a long period of chronic consumption, people come down with chronic kidney failure, even a chronic NSAIDs abuse. A lot of people abuse painkiller a lot, and this particular painkiller is grouped under the analgesic known as the NSAIDs. So it is very important that we know what is the cause of chronic kidney disease, and also reduce the incidence and the prevalence of that condition. So if you are hypertensive, controlling your hypertensive state is a vital role towards you reducing the risk of coming down with chronic kidney disease. And if you have diabetes, it is important that your blood sugar should be in check and monitored, and you should be adherent. You should stay adherent with your diabetic medication to reduce the incidence of chronic kidney disease. And not just that, if you're among those people that abuse NSAIDs too much, it is very important that you reduce your intake of NSAIDs, because NSAIDs can cause people to have a chronic kidney disease. And chronic kidney disease is something that most people cannot handle or maybe take care of them, because many of them don't have money to finance dialysis, which is an artificial kidney, to help them to regulate this function. So it is important that we are educated about this condition, also reduce the risk factor involved. So what are the signs and symptoms you see in a chronic person that when there's a chronic renal failure? Example, the person comes down with a puffy face. The person, maybe if the person urinates, the person comes down with a frothy urine. That means the urine is so foaming that when you urinate, even when you flush the urine will not dissolve, or maybe the urine will not get flushed. It keeps becoming foamy. That is a frosty urine. And not just that, a lot of people come down with a lot of pain. A lot of people come down with bilateral leg swelling. Maybe the two leg is swelling up, and this stuff kills a lot, because the function of your kidney has been compromised. And once the function of your kidney has been compromised, then there's a high tendency that your life expectancy is reduced, and that is very important. So stay healthy is one of the vital roles to reduce the risks of chronic kidney disease. I still remain Dr. Maxilo,